Alrighty, for this ed talk, I'm going to talk about the principles of balanced anesthesia. There are 6 groups that we target when medicating our surgical patients. The first one is going to be anxiolysis. We want to reduce any anxiety that our patient is experiencing pre-op. A good option for this could be midazolam. Number 2, amnesia. We want to make sure that our patient doesn't remember anything from surgery that could be considered traumatic or painful or scary. There's a handful of drugs. One of our options that we have is ketamine. Number 3 is analgesia. We want to make sure that our patient doesn't experience any pain or feeling when we perform surgical intervention. One option that we have that is widely used is fentanyl. Number 4 is akinesia. We want to make sure that our patient does not move while on the surgical table. So a medication that we typically use for this is rocuronium. Number 5 is autonomic blunting. Typically when you're messing with all of these different components of the body, you can see shifts in hemodynamics. So in order to keep heart rate and blood pressure in check, a common drug used is esmolol. Finally, when our patient wakes up, we've given them a lot of medications that can induce post-op nausea, vomiting. So one thing we could do for anti-emesis is administer ondansetron. A lot of these drugs work on multiple different groups. Maybe you could list some of them in the comments for feedback. However, something to take note of is volatile anesthetics. The gases that we administer intraoperatively actually touch on all groups 1 through 5. The only one that it does not touch on is the anti-emesis.